Hi, everyone. We're here with Grand Rounds for December with Dr. Tom McCoy. Hi, Dr. Tom McCoy. How are you?
Fantastic.
Happy holidays to everybody, and thanks for the accommodating patience with pushing it out a week. And it's never seems to be a good time in December, but I'm going to let Tom set it up, and it will potentially lead into why we pushed it a week, and also the highlight around the topic for this evening. So go from there.
Yeah, we had been planning on doing a bit of a kind of a year in review recap this month, and then the forces in the universe kind of projected a topic onto us. So um yeah, both Jen and I had parents who ended up having pathologic fractures in the same week before Christmas this week. One from a mechanical fall outside on the ice, and one that was triggered by getting out of bed and stepping down on an osteoporotic foot. So we want to talk about that experience as kind of kids helping to care for parents who go through an acute injury like that, and take a look at some of the data around the widening health span lifespan gap. There's a large study that was just published this month, actually, in JAMA, that gives us an opportunity to reflect kind of on where we are around the globe, and in particular in the United States, as we have gotten really, really good at keeping our brethren alive with more and more chronic disease. And then talk a little bit specifically about bone mineral density in particular, and research that has shown kind of particular fitness interventions have been able to have really impressive, not just mitigating the decline, but actually reversing and positively developing bone mineral density, which I think is really exciting and something that's important to understand. So we'll talk about the particular kinds of fitness that can help do that, which is important for all of us as we get older, but also for encouraging those family members of ours who are generations ahead of us to continue to stay active. But before we dive in to all that, Jen, why don't tag you're it? You go
Okay.
first. Talk a little bit about kind of your experience with your mama.
Yeah. So it's in this fall with my mom actually happened on December 5th, and it's taken every bit of my emotional reaction to not like soapbox this to our affiliate and like just beat into them how important it is, not only the work that they do like as members, but to not make them like bring up in everybody that doesn't do any sort of lifting. And so my mom slipped and fell on the ice like in the first major snowstorm in Northeast Ohio, walking her dog at 5:30 p.m. the evening before was her last day of work for retirement, right? And she's 67 years old. Slipped, fell, 911, can't move, didn't know what the hell was going on, like had to take fentanyl up the nose because they couldn't find a vein like in her arm to even start her on pain meds with 5 paramedic in her house. Like just the experience of it all for her was very traumatic, right? And so we get to the ER, we try to do x-rays, you know, to the credit of the ER staff, like they're not orthopedics, and it was a late night radiologist, and so there really wasn't a lot of information that came out of reading her x-ray, except we think you broke your shoulder and here's some pain meds and go home. And so that in and of itself was traumatic for her as a woman that didn't know or have confidence in the way that her body should or could react to something that was physically traumatic. But then as we've been going through these appointments with a couple different orthopedic surgeons and her PCP and kind of all of this, it's come back to, this type of fracture that happened wouldn't have happened to me or to the doctor, right, who's, younger than I am. But this is because you have osteoporosis. And I can tell that by the quality of your bone through the x-rays and the CAT scans. And so Yes, the humeral head is broken, and yes, you have fragments coming off of your shoulder, but the only surgical option is a complete shoulder replacement because the bone does not have the potential to fix itself through screws or any sort of other, surgical interventions because it's in such poor quality. So that's kind of number one. Number two, and this is just for me, not once in the last 3 weeks have we talked about um, risk factors that go into potentially why she has osteoporosis and how we're going to help the recovery process through any type of lifestyle interventions as we're kind of working through this. So I think that that's like a very large umbrella of things that we as a CrossFit community can relate to in terms of things that we can do to be impactful in health, but that's kind of where we are in real time. So that's my experience the last 3 weeks.
Yeah, I think, there's certainly a lot to unpack there. Your mom's injury was much more significant than my mom's, which is a foot fracture, and we'll talk about my mama here in a bit. But um, I think some of the things that you alluded to in describing that situation, the experience are, and there are things that we talk a lot about in CrossFit and in the affiliate is kind of building resilience and capacity for kind of adversity, right?
Mhm.
So that's, physical or emotional. And for many of us, right, we don't get faced with that on a consistent or regular basis in our day-to-day environments if we aren't kind of actively seeking it out. And if we are faced with it, and it's not kind of our own choosing, oftentimes how we deal with, stress or adversity is rather dysfunctional, right? Do you want to talk just a little bit about that aspect of it with kind of your mama and what that experience has been like?
Yeah.
I think
No,
just
definitely.
understanding the timing and her
Yeah.
returning from her job,
Yeah.
it's happening the
Yep.
same time, just
Totally.
emotionally, it was so
Yeah.
much for her.
Yeah, and I'll caveat all of this with I've owned an affiliate for 10 years and I've been trying to get her in here for 10 years. So I can empathize with the challenge that it comes with dealing with somebody who doesn't fully grasp the importance of some of the things we talk about, right? And so there's definitely that component of this side of the table when you have to have a willing participant to enact lifestyle changes. So like I understand that completely in real time. But, we're going from, a lifestyle situation where there's a routine built into what you do on a day-to-day basis, where you find purpose, where you find community, where you find, a lot of the things that go around the work or the joy that you find in it to having to transition out of that in and of itself, right? And I think as we're watching our aging or elderly parents or people that we know that are going through transitions in life, we can empathize and understand with the mental challenges that come with having to transition into something that's new and different without fully understanding what that can mean. So I think that there's definitely that. And not having a skill set built into understanding what resilience means or how to work through those challenges, like Tom, like you said, there could be emotional fallout in and of itself, right? And then now you're layering on something that's traumatic, something that's taken you not only out of your day to day, but you don't even know what you should be striving to return to, right? And, this to me, the frustrating part is that we see people that go through much harder and much more challenging experiences that show much more resilience, right? In an attempt to come back from that because of the experience that they've had from the CrossFit community and what they've learned during that journey and how to work through, individual and personal challenges to be able to come back. And so, you know, the members of the affiliate know me so well. And when I talk about this, they're just waiting for me to like say, just get your fucking shit together, right? Because that's what we would say to each other when we're in the affiliate, right? If it's hard, it's like, come on, you got to take the next step, right? You got to do the next box jump, you got to do the next rep, you got to stand up and you got to move on. And so we can't discount the importance of what we get from that experience as community members in and of ourselves. So
I think all of us, I think we can forget that this is, you're investing in your capacity to be able to tackle the challenges that are coming in the future, right? Both physically and emotionally, when we do CrossFit on a regular basis because of that built-in kind of voluntary personal subjugation to intensity and challenge on a regular basis, right? Um, I think the other big part of it too, which is really important for all of us to understand, is that like that week would have been very traumatic for your mom in and of itself because she was
Mhm.
leaving her job, right? And that was where, I think a fair amount of her friend circle was, and her social interaction and everything else, right? And so, she lost that potentially at a time when that was going to be most important for her, right? To be supported through an intense incident, right? And I think that we talk a lot about the data and the importance around community, right? And what that means. And an injury like that, especially as you get older, and if your friend network is older, right, it can be very, very isolating and pull you away from one of the strongest influences on your health and well-being overall, right? But when you're integrated into an affiliate where there's some, degree of variation in age range, right? You've also got some built-in insurance on, people checking in on you. You know that some folks are going to swing by, people are going to be reaching out to make sure you have what you need, you're going to be taken care of. I mean, we all have stories like that in our affiliate, right? And we have, people, we have this not infrequently, right? When people have a serious injury, they have to have surgery, like people just come in to hang out.
That was exactly what I was gonna say. I'm sure anybody that listens to this that goes to an affiliate, whether you coach or own it or you do or whatever, there's has to be some example where the person just can't stay away from the community, even if they're not coming in to do class, right? A woman that had a baby that knows that she can't do anything for 4 weeks is gonna come in and hang out with the newborn in the carrier because she wants to see people, right? We had a member that had diverticulitis, right, and just couldn't come in and work out, but it's like, I'm not gonna miss at least seeing everybody else suffer even though I can't do it with them. And so that draw back in because you don't wanna be a part of that, like, that is so important, and we just should keep talking about that, like, that is just crazy important.
Yeah. So we can talk a little bit about where, I guess your mama is and this experience. Because now, how many weeks in is she now?
So she's 3 weeks in exactly today,
So,
and so in another
what's the game plan as far as kind of intervention, surgery,
yeah.
not surgery? Has she decided yet?
Yeah, so we're gonna wait till the 6-week mark, which takes us to January 15th for another set of scans to assess how the injury has healed because it's going to heal, right? Um, how it heals is now the question mark. And so, assuming that, the bone fragments have come back into a place where physical therapy can begin, then she can start doing that at the 6-week mark. And then it becomes another 3 to 6 month journey of, not only regaining some caliber of a range of motion from the injury, but we're talking atrophy, we're talking a stiff elbow, like we're talking about, balance issues, like we're talking about a lot of things that go into the recovery process in hopes that she'll get to a point where that level of recovery will accommodate the type of quality of life that she wants. I mean, because the surgeons were very clear that like she's never going to go like this again, right? But if she was never doing a push press anyways, this didn't matter, right? Full extension at the elbow. Is this going to be okay for her? And can she do everything she wants with that? Like that becomes then the discussion point 3, 4, 5 months down the road to, understand what we're doing. So I don't want to exaggerate the detriment in overall quality of life because we're talking about a broken bone here that will heal and will allow um, you know, some renewal of normalcy when there's very, very significant health issues that people deal with that do not allow them to return to any sort of normalcy. And so I don't want to mitigate that, but very quickly what you're used to doing, right, can be taken away from you. And if there's things that we can do and we can help educate others on, a way to prevent some of these things from happening down the road, then I think that that's kind of what our mission is. And that's how affiliate owners and coaches and healthcare providers can approach this topic is what can we do to mitigate risk factors for some of these injuries, right? Because osteoporosis and osteopenia, that's a chronic disease, right? We talk about, high blood pressure and high cholesterol and all that stuff, but these are also chronic issues.
Yeah. Yeah. Well, my mom's um injury was, thankfully a lot less significant, but a lot of the same corollaries as far as kind of what it's manifested into, right? So my mom has severe now osteoporosis because she has a pathological fracture to go along with her bone mineral density score, which is in the deep negatives. I think it was her DEXA scan T score was negative 3.3, and
Mm.
we'll talk, a little bit about that. And she's, had that for years and has taken numerous different medications. And just as was the case for you, it is not been due to my lack of try to get her to do some form of, resistance training or something else, right? And it's just hard, and it's also hard with family members. And I try not to play doctor with family too much and to get too aggressive and encourage them to see their providers. But when it's wait until something bad happens and then take this medication, which really doesn't work that well in the first place for many people, it can be really challenging and not the right thing to do. So, you know, my mom just stood up out of bed and stood down on her foot and said it was like a sniper took her out, and she just fell to the ground, and she, cracked her fifth metatarsal on her right foot in half. So completely snapped, displaced, pathologic fracture, not a Jones fracture, thankfully. And this is probably a little too deep in the weeds, but with metatarsal fractures in the foot, one of the things you always want to make sure is that it's not a Jones fracture, which is a particular type of metatarsal fracture that happens at the proximal aspect of that fifth metatarsal, and it involves the articulating surface of that bone. So if anybody ever breaks their foot, you always want to ask them, especially if it's a fifth metatarsal, that bone on the outside of your foot, which is a very common one to break, is it a Jones fracture? And that means that the crack or the fragment can go through the articulating surface of the fifth metatarsal. And if it does, that's more serious. And usually the interventions are often than not surgical or a much longer period of immobilization, because the blood supply to that aspect of the foot is quite poor, and poor healing and non-union is much more common in that area. So just a pearl for folks to remember. So hers wasn't, and she went to the first doctor, and they put her in a walking boot and told her, well, we could do surgery, but you don't have to. You can see how it heals, and that's kind of it. And the real challenging thing for my mom is like her physical activity. What she does is walking. Like that is it. Like she doesn't do anything else, but that's how she gets out of the house. That's how she gets around. That's where her social interaction comes from. And she, not too long ago, moved back from California and is now in sunny, northeast Cleveland. And still out walking miles and miles every day, and now that's gone. So, total change of lifestyle and quality of life with that injury. And although thankfully, she can get around with a walking boot, she really doesn't have any pain. She can't go outside because it's the dead of winter, right, in Cleveland, and there's snow and ice everywhere, and she's in this walking boot. And even if she could, be freezing or get soaking wet if there's snow, it just doesn't feel stable, right, or safe. Combine that, she's got bilateral cataracts that she's now dealing with and was supposed to have surgery on this week. So she's like blind and now gimpy on a foot. And, it basically turned our holiday plans upside down. She's supposed to come over and hang out and couldn't drive. My son went over and spent time with her today, but very, very disruptive and isolating, right? Which compounded on top of the kind of objective medical experience that both our parents have gone through with the pain and the emotional trauma of having all of this happen, right? Is kind of the social isolation and loneliness, right, that gets exacerbated by being, older women, right, who are living on their own, and now being even more isolated. So I think, we'll talk about this as we get towards the end and get into these studies a little bit, but I just want to reemphasize how important it is because, for you and I, right, if I fall on my shoulder in another 23 years, or you get up out of bed, I like to think that your foot wouldn't spontaneously fracture, and I wouldn't shatter my shoulder, right? Because being
Mhm.
adequately muscled and doing kind of high impact loading resistance training, as we're going to talk about, right, is the best kind of insurance policy against having to go through this, right? And this is going to be and continue to be life changing for both of our parents. You want to pop open
Yep.
the slides
Yep.
and we
Let
can.
me screen share and then you can go through it. Dun, dun.
So we'll provide links to the studies that we reference as we're moving through here, guys. There's just a couple of them, but they're both really good ones, and I think ones that we want to be familiar with, working in fitness and as healthcare professionals. These are things that you can use as discussion starters with your patients and your families or your members of the affiliate, to kind of reemphasize the importance of
Mhm.
why doing what we do is so valuable.
All right, hold on, it's coming.
Okay.
Okay.
So I think the first thing, oh wow, look at all those tabs.
Shh. How are we now?
I can't see them. I think the first thing that we want to acknowledge is this kind of widening gap between health span and lifespan. And this study just came out this month, actually, in JAMA, looking worldwide at 183 countries that are WHO members with the state of the union between health span and lifespan, right? So the number of years spent in quality health uh, compared to the number of years of total life. And you go ahead and skip to the next slide, Jen. And what we see when we look at the trends globally and even more drastically here in the United States, which we'll talk about here in a moment, is that that gap is widening, right? Where in 2000, you can see that we were essentially at 8.5 years of a health span lifespan gap, and that um, by 2019, over the past 2 decades, right, that has increased to 9.6. And you can jump to the next slide, Jen. This plot, and you'll see where the U.S. typically is the outlier on most of these graphs, right? But we spend the most years compared to any other country in disease and disability. And what our parents are experiencing now is a really powerful example of that, right? They have had a serious health event, right, related to a chronic disease that is now going to change the quality of life that they're going to have for the foreseeable future. And it impacts, not just them, but their family members and everybody else around them. You can skip to the next one, Jim. This graph looks at all-cause mortality, and I do think it's important to understand the significance of bony fractures, and in particular hip fractures. And for the United States, you can see that unintentional injuries are kind of one of our biggest drivers of morbidity and mortality, in the third leading category, right behind heart disease and cancer. Thankfully, COVID has fallen back down from the third spot down to 10th in most of these graphs, both in the US and worldwide. You skip to the next one, Jim. Um, the numbers on this are pretty startling, right? I think we've talked a little bit about this before, but if you fracture a hip, right, your all-cause mortality over that next year is nearly 30%. I think 27% is the number cited in this particular article. Some are higher, some are a little bit lower, but the impact here is very, very significant, right? So if you have a family member that breaks a hip, right, their likelihood of dying over the next year is 30%. That is a huge, huge number. And that really reinforces the importance of the type of fitness that we do with impact and load bearing in the CrossFit methodology to really help take this driver off the table for our population, which is huge. And this study, in addition to the 1 year increased mortality, is that they also note that you see an increased impact of morbidity and mortality for a decade, right, after these fractures, right? So you differentiate yourself from the standard population when you have a fracture, particularly hip fracture like this, for the next decade, right? So this event happens. It's not just about getting through that first year. For the next 10, you can be negatively impacted as far as your risk for mortality, which is pretty amazing. You can jump to the next one, Jim. This graph just really highlights the impact of musculoskeletal disorders and diseases and how significant they are as one of the main drivers behind that health span lifespan gap, and these being one of the main categories that people live with in that kind of decade of disability, which so many Americans experience. And one of the reasons why building adequate skeletal muscle and bone mineral density in the way that CrossFit helps us do is so vitally important from a foundational public health standpoint. Go to the next one. This study, I think, is one of the best ones highlighting the importance of kind of lifting and higher impact resistance training. And we'll put a link to this in the notes so folks have it. But Beck et al. This is out of Australia, and she's made the rounds, and this is a very well-known study, so folks are likely familiar with this. But essentially, what they did at her clinic was design an 8-month trial where they took two groups of individuals. It was a control and an intervention group. And all they did were 2 sessions, two 30-minute sessions a week for 8 months. And the modalities in the intervention group were deadlifts, back squats, front squats, I believe, and then jumping pull-ups where they would release and fall to the ground with impact. And all of the individuals in the study were over 58 and had, I believe, osteopenia and osteoporosis and had to be free of other significant comorbidities or have taken medications that would have impacted bone mineral density, et cetera. And so they followed them for 8 months. And the control group just did a home-based kind of standard cardiorespiratory protocol with chair exercises, et cetera. And then after this 8-month period, so again, just two 30-minute sessions a week, they went back and measured bone mineral density at different locations, mostly in the femoral neck and in the lumbar spine, which is where osteopenia and osteoporosis are primarily diagnosed. And not only did they see a slowing, right, of osteopenia and osteoporosis development, which you would hope to expect, but they actually saw positive bone mineralization and strengthening over that period of time for people who are, in their 60s and 70s, which is really remarkable, right? I think that, before this type of research, it would have been very surprising for many folks to think that, you could do that at a more advanced age, but it certainly is doable, and this research has shown that to be the case. You can jump to the next one, Jen, see what else we have.
Hold on. Trying. It's frozen.
Okay.
There we go. Let me try.
That's okay. We can wrap up there.
Okay.
So, I think that the cool thing about this is that the interventions that they used in this study were things that we do in CrossFit every day, right? And so, this intervention, right, was this high intensity resistance and impact training. So HIRIT was, the acronym that they use for the most part, right? And so we do that. They were working off, 70 to 85% of one rep maxes for their lifts for a lot of it. And then these jumping pull-ups and allowing themselves to fall to the ground for that impact, which is, key for bone mineral density, which is the type of stuff we do all the time with box step-ups and box jumps, or stepping up to a plate and back down for a long time, right before studies such as this came out, load-bearing exercise was thought to be contraindicated for individuals who had osteopenia and osteoporosis for the increased risk of fracture or injury. And so one of the points that the authors of this paper, who also run a very successful clinic focused on bone mineralization and bone mineral density in Australia, is that the exercises be led by informed um, coaching staff who understand how to introduce load in a safe and effective manner. And out of all the people that went through the protocol, I think they had one person who had a low back strain who missed a couple of workouts, but there were no other more significant injuries, which is really rather amazing considering the movements and the types of exercises that people were doing. But it comes back again to us as coaches and a coaching community that we really need to be aware of the prevalence of osteopenia and osteoporosis in our communities. There's projections in the United States that uh, over 50%, nearly 51% of women over the age of 50 have osteopenia, and close to 20% have osteoporosis, which is, a mind-boggling number, right? So, those individuals, if they aren't being coached and monitored and directed in the right way, can be at increased risk for injury, especially when they're learning how to do movements and what appropriate load is, et cetera, right? So from a coaching community standpoint, really need to be on our game and understand the ramifications of what we're asking people to do and the increased risk of certain populations. This too ties back in the importance of, a CrossFit nutrition strategy and why it can be so impactful and effective. And that, just as it does in skeletal muscle mass, plays a similar role in bone mineral density. And if you combine that with load-bearing exercise and high impact activity, right, that is a recipe for strong bones and continuing to develop strength in your bony skeleton as you age, which is something that all of us want, right? So that when your mom slips on the ice and when my mom gets out of bed, their bones aren't exploding, and it doesn't turn everybody's life upside down, theirs and their families, with something that's going to be a huge challenge for them to recover from, and it's not a days or weeks thing, right? It's going to be a
Right.
months to
Yep.
years thing for both of them. So it's really significant.
So we'll definitely make sure that these articles are not only linked to Grand Rounds, the webinar, but also just kind of as a resource in the affiliate owner tool kind of kit, if you will. Um, this, I don't want to say this angle, right? But this example of, this disease and the exacerbation of it, right? We we see people that might not classify themselves as being sick or needing care or, doing those things until something like this happens, like a fall and a broken bone and this, that, and the other. But, from an affiliate owner standpoint, like, women and men are diagnosed, especially 65 and over once they start getting DEXA scans and potentially before, right, with, you know, lower bone mineral density and they become at risk for things like osteoporosis. And so to have a program or to have information or to have a resource where you can be a place to welcome people that need to know and understand and learn how to move their bodies in a safe, effective way, like it's not just about, decreasing percent body fat and improving VO2 max and kind of doing all of these things, right? Which is really helpful to primary care physicians as well. But it is also this, right? It is also osteopenia, osteoporosis, a disproportional amount of lack of lean muscle mass, right? And all of those things that we know to be true about muscle being a organ of longevity and kind of all of this stuff. So this is a really impactful way as well to make connections with people in your community that work with a middle-aged or above population. And then when we look at adherence rates to medical interventions, right, we know that it's significantly low, especially when that involves major behavioral changes. So saying to a 65-year-old woman that she needs to go find somewhere to lift weights and do resistance training, that's probably a non-starter for them, right? Like that's not going to be a thing that clearly that's going to be, done well on their own. And so to come into a community that can support the learning process of this, and improve the adherence rates to medical interventions that need to be based on changes in behavior and lifestyle, the affiliate is the home that they need to come to. Like we need to bring them in. And so I'm gonna stand on that soapbox for a while.
Yeah, and a couple other things. DEXA scans aren't recommended
Right.
by USPSTF, I think until age 65 for women, right? And you compare and contrast that to the prevalence that we just cited in regards to osteopenia and osteoporosis for women over 50. It doesn't make a lot of sense, right? And those guidelines, in many ways, are designed for the sweet spot between cost effectiveness and not overdiagnosis, and when you can actually do something about it to intervene, right? And they're not personalized or really the practice of precision medicine for the individual, right? So if you have somebody who's new into your affiliate and they're coming in to be seen and they have risk factors, I mean, and we get body composition, analyses and DEXA scans when we can on all of our patients, right, who come into the practice. But, when you have folks coming into your affiliate and they have risk factors, right? So they were, a smoker for a long period of time. They've had fractures before. Osteopenia, osteoporosis runs in the family. They have poor nutritional status. They're very, frail, don't have a lot of muscle mass, right? These are things to think about. And if they haven't had any bone mineral density testing done, DEXAs are relatively easy to find. They're inexpensive. They're very low amount of radiation. And it can be a great way to identify kind of reasons to stay committed, especially with a lot of the things that we've talked about in regards to the associated morbidity and mortality of pathologic fractures, and something to track over time. Our first contributor to the newsletter and a first speaker on the CFMS did a wonderful presentation about kind of the impact of CrossFit and bone mineral density with members of her affiliate, and I'd recommend everybody go back to watch that first presentation too, because she cited a ton of wonderful data and studies. She may have even mentioned the study in there. I'm not sure, but it's a really important one for all of us to be aware of. And the beautiful thing is our methodology is kind of designed to treat this and put us in a position to mitigate any sort of injuries over the long term as we get older, so that we shorten that kind of seminal decade of life from disease and despair to one that hopefully is measured in weeks or months before we check out, so that we have as much time doing what we want to do, spending it with whom we want to spend it with, without restrictions or undesired dependence on other people.
Mm-hmm. Absolutely.
Yeah.
Isn't it? And I think it's at the L1. It might be the L2, right? When you're doing this to fight off decrepitude, right? So like we constantly try to push the continuum from, sickness to wellness to fitness in an effort to avoid decrepitude, which is really just a very descriptive way of saying aging at the end of the day, right? And so fighting that it's important for sure. So
All right, that's probably
okay.
enough of us ranting.
It's okay. Okay, so as always, this is for one CME. We'll post the questions along with this recording, so that you can get it all done together. This is the last one for 2024. And then we're back in January in 2025. We have a robust lineup, so I'm very excited to go back to the norm with our guest providers kind of coming on and giving a chat. And so yeah, that's what we got. Happy New
Bye.
Year, everybody.
Bye.
Bye. Thanks, Luke.